Hello friends, hope you have been enjoying this webinar with us. A life-changing breakthrough for this generation on gene therapy, which is all about permanent treatment of sickle cell disorder and beta thalassemia. Today we are going to have our third webinar with Dr. Ugochukwu Ugbuna from the United Kingdom, a specialist in regenerative medicine. Why not sit back and enjoy this life-changing with us? And I'm sure you're going to have a good news to share with your friends. Cheers and bye. Thank you. Thanks so much, Doctor, for that enlightenment.
Thank you.
So educative. Now, this is the moment I'm sure every one of us we are really waiting for, to ask more questions, to be able to understand more on what we are talking about on gene therapy. That is permanent treatment of sickle cell disorder and beta thalassemia. Hello, family. Friends, hello caregivers, hello warriors, hello our wonderful friends on this wonderful platform. This is an opportunity for us. I'm sure we all have questions to ask Doctor. So let's open the floor. You can go ahead. If you want to ask a question, you can signify by raising your hand. Then you can go on. Okay. Hello, you can on the platform. This is the question and answer section. You can signify to ask your question by clicking on the raising hand button section. Hello, if you have questions, okay. All right. Etombai, thank you so much. You can go ahead and ask your question. All right. Then after, I think we will have Abby Wendy. So let's Etombai have his question. Thank you. Can ask.
Hello, yeah, thank you for the introduction and taking us through everything. I just wondered if you could explain a bit more about the actual pathophysiological process that the treatment works by.
Okay. Like I did explain, the mechanism, and I also explained the type of treatment it is. It is a stem cell treatment that has a molecule and vector agents that drive it to the gene level, and a molecule that is also built into it that does the reversal of the mutated gene. So you will expect the gene alteration by way of the components of the therapy itself. It is not a procedure. It doesn't require harvesting the stem cells from the bone marrow and purifying or editing it in the test tube. It is all in vivo, meaning that the work has been done in the formula. It is oral. It is 100% phyto cells, no preservatives. It is designed and formulated the way you have biologics, the class of treatment medications called biologics. It has 0% of synthetic chemicals in its formulation. Therefore, that warrants some high level of safety. It has been tested, it has been certified, and we are following certain procedures before mass marketing. We are operating under what WHO, US FDA, European Union Medical Regulatory Agency, the UK Regulatory Agency, and other global regulators. There's what they call compassionate use clause. Compassionate use is where you know or you have cases that cannot wait until final clinical trials or until regulatory approval. Meanwhile, it's been certified that it's fit and it will help people. When somebody is wheeled in under emergency A&E in the hospitals, if you do not use this, that person may not survive. And we know the urgency and the critical nature of sickle cell conditions. Having been doing the sickle cell clinic for years now, I have had some cases where warriors or their families will make inquiry and go to prepare for treatment. Before that treatment, a crisis comes, and that may be the last crisis. So everywhere in the world, they understand the sense of urgency in handling sickle cell disorders. It doesn't, in some instances, it doesn't allow us so much of time. Therefore, since it's been certified safe, since it's been certified efficacious, and other conditions, now we do treat people with it. And I make bold to say that for the past 3 years and counting, with this HS 1.0 that has this reversal molecule, we have not had any relapse on any of the warriors that have been treated and have been up and going. I don't know if that explains your question with respect to the mode of action.
Yes, it does. With respect to the success rates and the trials you've had already, is there somewhere where we can read more about this, a publication or something?
You will eventually. What is happening is that you know that it takes, on the average, 7 years and above from test tube to the bedside or over the counter for any of these approvals. You have stage 1 successful, stage 2 successful, stage 3 successful, stage 4, before regulatory authorities will say, okay, now go ahead. Meanwhile, you do not publish this because they are all proprietary information until after that time. Once it's been flagged off, you can then publish. You will now go on road show, do visit doctors and their associations and hospitals and mass marketing. That is why most of all these things are not yet in the public domain with respect to the data. But what we do is to refer people, because essentially the big pharmaceutical companies, they enlighten doctors and communities on what is about to come and what is ready. And you also know that with this compassionate use clause, they use it to start administering before data are fully published. It is a competitive world, so these proprietary information, they are not available to the public domain. That is why when we hold open houses like this, we explain and refer, so any other hybrid way you may want to get to this, we are open to it. You can always get across to the organizers of this webinar, the World Healthcare Foundation, Their numbers will be flashed intermittently on this program. Hello, Etombi.
No, that's great. Thanks for explaining that. Thank you.
Thank you.
All right, thanks so much, sir. Etombi, thank you so much for that question as well. We have Abby Wendy now. You can go ahead and ask your question. Thank you.
Yeah, good morning. I just want to confirm, after this treatment, please, will the patient still experience crisis afterwards? I just want to confirm. Thank you.
Miss Wendy, you're hearing from me today. I am telling you that the patient permanently will not have crisis again from sickle cell disorder. I'm also telling you that we give guarantee, which we consider to be a lifetime guarantee, that after this treatment, if the patient comes down on crisis on this, we will repeat the treatment on that patient 100% free of charge. For 3 years counting now, we have not seen anyone. We have seen people coming from the US to UK here for this treatment. We have seen people come from Canada. We have people coming from Netherlands and Germany. We have Nigerians coming here. We have some other Africans coming here for this. We also now have developed, we send some of our doctors to different locations when people call for it. What we're also doing is that for each case we undertake, we have either an affiliate doctor who is already the primary physician to the warrior. We liaise with them to monitor, and they give us their feedback. It's from those referrals that these words have been going around, and we are getting calls from as far as Australia to Colombia to Brazil. So the word is going out there. We also know the type of industry where we are operating in. It is conservative, it is ethical, it is also investment for the big boys. So we apply very thoroughly. We cross every T, we dot every I along the line of this journey. But our primary focus is on the health, the life, and the degree of empathy with warriors. I know this Saturday morning, as early as it has been since 10 a.m., most people who have worked over the week, they relax and rest on Saturdays or do some other things, events, occasions, shopping and stuff. For anybody to have come up this morning to listen and watch this webinar, which we are now doing every month since July, this is the 4th one, means that the person has special interest over this matter. Unless one has not interacted with a warrior, that's when part of your body will not be with that warrior. If you have interacted with warriors and their family members, or you are a warrior, believe it or not, you are more than a warrior. You're also a conqueror, because it takes so much of energy, so much of resources, so much of love to deal and handle with this. I have encountered so many. From my childhood, I had friends and neighbors who went through this. Some of them are alive today. Some of them have passed on. Until you have come across this, you just cannot step away from this world. Even if you are not involved, you will do fundraising, you will support, you go on hospital visitation just to tell people, to comfort people, or you'll be hearing sorry, sorry, sorry. So those are the motivations and the drives behind our movement on this. It is actually a movement, and they will catch on. And please, anybody who has come through, support the next one way or the other. let's make sacrifices and get rid of this. It can be done. Thank you.
Thanks so much, Doctor. Thanks so much, sir. All right, sir. We still have time for more questions and answers.
We are here.
All right, sir. Thank you, sir. So please, let's go ahead. I'm sure we have questions to ask for more enlightenment. Can go ahead and ask our question. Thank you so much. Can signify by raising our hand by clicking on the question button.
Yeah, please, I want to ask another question. Is there any age limits for this? Can a 4-year-old take the treatment, and how many packs is required? Thank you.
How many what?
Like, how many packs is required for a 4-year-old?
Okay. Yes, a 4-year-old can be treated. Yes, 4-year-olds have been treated. Yes, 4-year-olds responded to the treatment. 100, absolutely. 3-year-olds, absolutely. 2-year-olds, absolutely. What you have here is that scientifically we figured out that we have 2 categories to deal with here. One category are from the newborn ones, which we suggest we wait till about 2 years of age, even when we have identified that they are warriors. Let's wait till 2 years of age when they can imbibe this oral treatment. So we have the first category from the young ones to the age of 11. Then the next category from 12 years of age to infinity. The youngest we have treated is actually a 2-year-old. And the oldest we have treated, at the point she was about 62. Now she is 65. Have we treated the ones that have gone through bone marrow transplant? Yes, we have. Several of them. Up to 5 of them. One particular one was the very pioneer set in the year 2000 in Boston, Massachusetts. And she lived happily. She's in her 50s now, in her late 50s now. And after some years, she had a relapse. And the hospital in Boston said, yes, we will have to redo the procedure. What it meant was that the hematopoietic stem cell that was transplanted had weakened up, or we may use the word had expired, and couldn't proliferate new red blood cells devoid of the sickling. So they have to do the procedure again, meaning putting back a corrected one or donated marrow into her. So when she heard about us, she journeyed. She didn't come to UK yet. She flew from the US to Nigeria, our clinic in Nigeria then. And that's where we treated her. We've also seen some cases of heterozygous sickle cell, meaning HB, instead of HBSS, HBSC, that do have some form of aggressive crisis. And those ones, regardless of the amount of the transplantation, the frequency in them relapsing after bone marrow transplantation somehow is usually higher than HBSS. But with this hemostim, we started with the first one that came presenting was in 2018 or thereabout. She actually came from US too. She came from Atlanta, Georgia then, and we treated her. By that time, the hemostim had not started having the reversal molecule. It was just producing regular round blood cells. Eventually, when we came up with this, knowing fully well that our HBSC is the aggressive type, the moment we got the reversal molecule that warrants that permanent reversal, we called her in. She flew into UK and we treated her at zero cost, because anybody who has been on our book as our patient, as far as sickle cell disorder is concerned and its gene reversal, it is on us. We keep to our words. Most people will be saying, why are you not on the net? Why are you not telling people on social media? Medical treatments are what we consider to be ethical products and services. In old medicine, you do not advertise till today. You do not advertise the expertise of a doctor. So do you not advertise the services of an architect or a lawyer. I know that in the modern times now, marketing is coming up with a hybrid where they use different ways to advertise. But you rarely do see doctors advertise in that sense of advertising. We can cure cancer. We can do this. They will tell you, do enlightenment of new conditions, new procedures, new treatments, but we don't print flyers and leave it in phone boxes all over the town and the city, But by word of mouth and seminars and now webinars, we believe that the new technology will take us further in terms of outreach to let people know what is available until such a time. Thank you.
Thank you so much, sir. Thank you so much, sir. So the next person can ask. We still have more time for question and answer. Thank you, friends, for listening. Can ask more questions.
Okay, I want to ask a question.
Go ahead, please.
My name is Edidion. I'm in Nigeria. I am a warrior, and I'm age 40. Yeah.
Okay.
So, what's the cost of getting this treatment over here? Southern Nigeria, precisely.
Okay. What we are doing, first, I mentioned about the two separate categories. From age 2 to age 11, cost $12,500 US or 10,000 UK pounds. Whatever the exchange rate of that country is, we will now work it out on the rate of the day. About 3 weeks ago, one of our doctors went to Kenya. We had about 3 patients, and he went there with entire treatment and remained there for 15 days of the treatment. For categories B, meaning 12 years and above, theirs is 25,000 US or 20,000 British pounds. We are being a little bit ingenious in the sense that when we have 2 patients and above, that can justify the logistics cost of going to that particular place to treat the person. For the ones that have the access to come to UK, that is beautiful. in southern Nigeria, we do have our alliances in Lagos and Enugu. Depends on where you live. From your name, Edidion means you're from Akwa Ibom or Cross River. I'm not implying that you live there. But if you're in southern Nigeria, any of these two locations, be it Lagos or Enugu, will be ideal for you to be treated. What we are doing also, if we have somebody in Ilorin, have somebody in Lagos, have another person in Port Harcourt, you will bear with me that to coordinate this, we will arrange and have everybody pull into Port Harcourt, into Lagos. In that way, it becomes equidistant. And when we say 15 days, that's the duration of the treatment. It is actually for 14 days, but for compliance, to make sure that any wastages are covered by the extra 1 day. So the treatment, you asked about number of packs for a minor. A minor, the volume of their treatment is 30 cl or 300 ml 3 times daily. If you bring a cup of Capri Sun and throw it at a 2-year-old child or 3-year-old child, you will see the ease at which that child will drink it. If you bring the same thing for a 15-year-old, that 15-year-old will drink it with ease, but quicker. So we believe that these younger ones, sometimes they may not understand or appreciate the cost implication of this. So we try to stay in with the patients until he's been fully exhausted. Sometimes parents may be there to pep talk them. It's palate friendly. So number of packs for a minor below 12, 11 to 2 is the same 3 packs times 15. That's 45 packs. That 45 packs, the volume is 30 cl or 300 mils. It is small. Pure water sachet, what we call pure water in packs. I'm speaking to you because you're Nigerian, so you will understand what pure water is. Some of them are 30 cl, some of them are 50 cl or 500 ml. So that gives you an idea. Somebody can drink it in the morning, drink it in the afternoon, and drink it in the evening. That's one. For the elderly ones, 12 years and above, what we'll do theirs is 600 ml or 60 cl, which is double of these younger ones, their volume. Anatomically, what it will require to penetrate through the femoral head into the bone marrow in transporting this is much more, and it will require much more for the body mass index of 12 years and above. It will require much more volume as well to be able to enhance that change at the gene level that we are talking about. That's why 12 years and above, the same formulation, but double the volume. So it works for everybody from that till the, like I told you, the oldest we've treated, a 62-year-old, she's 65 now. The youngest we've treated, we've come down to age 2. Age 2 of a family that he almost, the man said he couldn't take it. It was tough. I'm not describing family conditions here, but I'm trying to give you the scenarios around why somebody will say, I will not wait any further. Let us treat her at the age of 2. And the child was treated, and today she's up and about and has not had any of these other conditions, you know. Thank you. Eddie, I don't know if I covered your question in terms of locations. And
yes, you have. You have. Thank
you. Thank you.
All right. Thank you, sir. Thank you, doctor.
Thank you,
All
madam.
right, sir. Person can ask question now. Thank you so much for listening. Are there any more questions, or maybe we are okay for now? Are we okay with enlightenment?
Olaide Alawode is raising the hand. Hello. Go ahead, Olaide.
Hello.
Hello.
Hello, doctor. Can you hear me?
Yes, please. I can hear you. I can hear you.
Hello.
Yes, I can hear you. I can hear you, please.
Go ahead to ask your question.
Go ahead and ask your question. Hello, go ahead and ask your question, please.
Hello.
Hello. Hello, you cannot unmute yourself. If you can hear me, unmute yourself.
Yeah, thank you, sir.
Thank you.
I appreciate your effort in this regard, sir. And I like the way your presentation rather.
Thank you.
This is a thing that has been my problem right away from the youth.
Okay.
And I'm above 60 now. I want to know whether I can still I don't know whether the treatment can be still applied to me and some other people above 50, 60 years. And the
Yes.
first.
Yes. You obviously you joined this webinar not too long ago.
Yes.
I have just finished explaining to Mr. Eddie, who also asked a question like that. And I explained that the oldest person we have treated, we treated her when she was 62. She is 65 now. And since that time, she had not had one single crisis. That was 3 years ago.
Thank God.
If a 70-year-old person comes presenting now, we will treat that person. What happens in the body of a 10-year-old or a 3-year-old or a 50-year-old is still the same thing that will happen in the body of a 60-something-year-old person. So it works for everybody. It's the same genes you have that I do have, so that every other person do have. Therefore, it's not selective. It's not like you're looking for a donor compatibility test. No, it works for everybody.
God bless you, sir.
Bless you too. And you asked about category in terms of cost.
Yeah.
We have it in 2 categories. People 11 years and below, their cost is $12,500 US or 10,000 British pounds. Why we are saying this is because as we are speaking now, people are watching from Colombia, from Brazil, from different countries, from Australia, New Zealand. And if we say it's in Naira, they may not understand. Then the fluctuations in the exchange rates. So we just have one unified price for people below 11 years and below, $12,500 or 10,000 pounds. For people 12 years and above, including the 70-year-old ones, their own price is 25,000 US dollars or 20,000 British pounds. What we also say, yes, the difference in that is that the volume for the first category, 11 years and below, the volume of their treatment is 300 mils oral treatments 3 times daily for 15 days. Whereas for 12 years and above, theirs is 600 mil, which is 60 cl 3 times daily. So you do the math and realize that the volume it takes to treat 12 years and above is double that of the minors. So that's why the price adjustment is that way. But the formulation is the same thing, and the outcomes have been the same.
Thank you, sir.
Thank you, Mr. Lowode.
You're welcome, sir.
Thank you.
Thank you, sir. Doctor, thank you, sir. Well, the next person, I'm sure we still have more questions to ask. Today's first webinar is really, really educating. For those joining us newly on this fourth webinar, I'm sure we have more questions. Can go ahead to ask.
Hello, can I ask a question, please?
Please go ahead. The floor is yours.
So you're based in the UK, right?
Yes, please.
And where's the treatment center, or how do people get in touch if they want to have this?
While in the UK? You mean in UK?
Yes.
We're in Manchester, and we're also in London.
And
So,
where do people get in touch or like try to arrange getting the treatment? How does the process work?
okay, you are here. We have our UK number as +44 7. Can you hear me?
Yes, I can. Thank you.
+44 735 404 8555. I repeat, +44 735 404 8555. Otherwise, you can reach us via ugogenetics, admin@ugogenetics.co.uk.
Okay,
Admin, you're welcome.
Thanks so much, Doctor.
Thank you, madam.
All right, sir. So the floor is still open for more questions. You can go ahead and ask more to get more enlightenment.
Hello, doctor.
Yes, please.
My name is Muhyiddin Alowonle.
Okay, Mr. Alowonle.
This is my second time of attending your webinar.
Okay, thank you.
And I believe we did a lot of engagements last time that we attended the webinar. But
yes.
I just want to still bring it on the table. If probably it's going to be in a kind of assistance for every one of us.
Okay.
I believe that I don't think there's anybody that can be the warrior or or the parents or the caregiver, the whatever that has anything to do with warrior. that you hear something like this, that you will not think of at least getting it for that particular warrior. So
This
I
is
told you
true.
the other time that I have a child. I have only one child that is warrior.
Yes.
For the financial implication of the drug, it is what is chasing us away.
Okay.
Based on the way that we are coming from Africa, especially Nigeria, that everything, the economy is not coming up the way we expected for now. We are talking for the so is an adult. We're talking about maybe 20-something million naira for the treatment, which is not too much to get a permanent solution for something like that. I think is fantastic, but only that we cannot our financial capability of some of us, I'm not generalizing, to get that drug for now is difficult. It's very, very difficult. I don't know if you can make it general and let us know how we can, the time of the payment for the drug, or how we can spread the payment and what will be in our targets on every monthly basis, on a monthly basis, so that you have it, we will be working towards it. Or if there is any discount that you can give us for us to be part of the beneficiary as far as this solution is concerned, because we are very happy about it. I told you that the solution is from us. It's from Nigeria-based solution, despite the fact that it's general for the whole world. But we are kind of very happy, and we want to be a beneficiary. If there is a way you and your team can assist us, so that at the end of the day, all this pain is going to become the past. So thank you very much, Mr. Doctor. I go to be with you.
Thank you, Mr. Muideen. Let me just put a word of support. To start with, I wish you divine strength in nursing your child who is a warrior. We are happy today that there is a solution. Every other thing, they say a problem identified is a problem half solved. We've identified the permanent treatment. The financial cost of it, we've already gone half the way. That will also come into play. I know that Rome was not built in a day. We have many years to underwrite the cost of research and development of this treatment. We do have institutional investors in our outfit. Those institutional investors came in as a result of the cost of research and development of this, because it is a very, very, very mega budget, and it is still ongoing. Why I'm explaining this to you is because I do understand. I have family members in Nigeria. I'm always in Nigeria. I do come into Nigeria quite often. I am Nigerian. I will die Nigerian. So when something of this nature affects me to my domestic core, meaning my Nigerian family, it's not just Nigeria. We are one family, down to Ghana, down to Nairobi, down to South Africa. Our economies are not far different from each other. In Nigeria today, it has been a world apart for the past 4 months. I'm not going into the politics of it, but the truth is that the Nigerian economy has gone further south since May 29th. So the exchange rate has nosedived so much. So even when somebody had the money 4 or 5 months ago, waiting for after inauguration, suddenly the money seemed to have evaporated. We understand. So going forward, we will be giving back to the society, we as a firm, as a company. However, for now, what we're encouraging is that people should look for neighborhood fundraising. There are some of these Lions Club, Rotary Club, the JCs, Sickle Cell Community of Shomolu, Sickle Cell Family Support Group of Plateau, wherever they may see themselves, the churches themselves, religious organizations, the mosque, these things are bound everywhere, all through our belts. So no one tribe is spared from this. No one religion is spared from this. No economic class is excluded from this. So it is all encompassing. I know that this message, as more people are keen into it, and as more people are freeing themselves from this bondage of life, the more the news will circulate. We know quite some people at the leadership levels, present governors, immediate past governors, long past governors, senators, big politicians, even the president not too long ago, whose grandchildren, up to 4 of them, they are in the UK here now. One of the daughters have about 6 children. 4 out of them are SS. They're in the UK here. So it doesn't exclude anybody. So the more we do this thing, the more we penetrate, the more we raise our voices, the more we hold street banners. I have never seen any condition or disorder that has so much strong support network more than sickle cell warriors. Their support network is far-reaching, and they touch everybody, be you white or black, no matter your race. Therefore, I know that the voice of warriors have always been strong and will be stronger when they have something to show. Governor, president, politician, what are you doing? There's a cure now. Do something. If you can pay for COVID, you can pay for this. If you can pay for vaccines for this, you can pay for that. Our message will even get to United Nations, because it's only in that way that those public health things they do, expanded program on immunization, where cholera, this, that, polio, all of them are eradicated. We will get to the point where it's not like we are blackmailing them, but we are telling them on empathy, please let the whole world syndicate fund for the treatment of this. Don't forget that when these medicines are made by certain companies from certain parts of the world, their voices are heard, and the United Nations, everybody will chip in money, and they will buy those vaccines from those companies, and they will now give it out through UNICEF or WHO to the rest of the world. Now that it looks like the table is shifting, we are not competing, we are only complementing what they are doing. So our complement has come up with something quite effective that benefits us and benefits them. It's not only sickle cell anemia that this hemostem reverses. It reverses thalassemia. Thalassemia is much more endemic in the Indian subcontinent over there. It's also not limited to people of sickle cell anemia. It's not only limited to people of Afro-Caribbean ancestry alone. It also affects some people living in the Mediterranean, whom we call the Arabs. It also affects Greeks. It affects Italians, Spaniards, Portuguese. It affects Chinese. So it's global. There are some people who consider themselves to be Caucasian. It affects them. The frequency of theirs may not be as much as ours in the sub-Saharan Africa. So it is everybody's condition. And we also use it to treat other conditions that are not just the sickle cell ones. It helps so much in other forms of anemia. So we're still going, but let us that is most affected with this critical one that doesn't give so much time when crisis hits. Let us raise our voices and we'll eventually get there. Thank you, Mr. Medin.
Thank you, Doctor. Thanks so much, sir. Mr. Moyedin, thank you for that question, sir. Okay, we still have more time for questions. You can ask questions to get more enlightenment. All right, in the absence of no more questions, you can close up for today, but let's thank our doctor for the explanation on what gene therapy is on today. Thank you, doctor, for that education, sir. Really
Thank you, madam, but I'll suggest something. Please, if it's possible, you can share your numbers here so that some other people who don't feel like asking questions in public can always reach you for guidance. There are some people who don't want their voices heard, yet they have some things they want to find out. Please get across the World Healthcare Foundation. World Healthcare Foundation. Their numbers will be displayed in a minute. Thank you. And we look forward to the next webinar in November. Their number is being displayed now. For anybody who wants to get in touch with them thereafter, with respect to these services, the number is there.
Hello, doctor. Thank you so much, sir. Thank family and friends for today. I'm sure before we close up, I'm sure our doctors will have some parting words to encourage our listeners. So thank you. Then you can close up, sir. Thanks so much, sir.
Thank you. Okay.
Doctor, do you have more advice for us, for our listeners?
What we will advise is encouragement, and we also want to ask people to look into their dietary requirements. Try to drink a lot of fluid. We try to take vitamin C where necessary, where advised. Alkaline diets like codfish oil, vitamin B complex. Some people go as far as taking vitamin D2 and vitamin K. So any of these things that will support and help, please try to identify them. The antibiotics are prescribed by your physicians because of infections. Where necessary, please try. It may be difficult, but try and just keep fit. Help is coming. Help is on its way. And for the ones that can afford it, help is here now. Thank you.
Thanks so much, sir. Thank you, doctor. God bless so much. Really appreciate
you.
Part of
Thank
time
you.
to lecture us more on this webinar.
All right.
Thank you, family and friends. Thank you, our caregivers. Thank you, everybody, for joining us today for this webinar. God bless so much. So, say thank you and bye-bye.
Bye.
So, get prepared for our next webinar. Thank you so much.
Yes.
Bye.
Thank you.
All right.